My name is Dr. Robin Bosch, urologist at CHI St. Joseph's. BPH stands for benign prostatic hyperplasia. It is a very common disease that occurs in men. As a matter of fact, if you live long enough, you will get it. It's a degree of symptoms that we have to assess to see who needs medication, who needs surgery. And so as you live longer, most patients will develop obstructive urinary symptoms. And there's a lot of medications out there, and what I'm passionate about is we're learning more and more about side effects of medication. Some actually linger even if you discontinue the medication. And it is unfortunate that men are not more forthcoming about side effects because it's embarrassing, such as sexual side effects. And they're even afraid to tell their partners, which is quite sad. But when they come to you with these problems, you want to be able to improve their quality of life. Historically, for an enlarged prostate, unless you had severe symptoms, patients don't pursue surgery because why should you? And the main indication for patients to proceed with prostate surgery and the standard and the gold standard has been transurethral resection of prostate, where we actually use thermal energy to cut and burn the prostatic urethra. So those symptoms of irritation can linger for weeks and it takes a long time for it to heal. However, those patients that need that surgery or are recommended to have that surgery are often struggling. They have bladder stones, they have significant gross hematuria or blood in the urine that won't stop. They have kidney problems because they can't empty their bladder all the way. That's a no-brainer that they should be intervened with surgery because you have significant medical problems. In comparison to resection of the prostate, where thermal energy is used to cut and burn the urethra, tiny implants are put in and it mechanically unobstruct the prostate. So it pushes the mechanical obstruction away so that you have a bigger channel to urinate. What I think is really important is because most men are bothered by retrograde ejaculation or decreased ejaculation, this is the only technology that allows a man to keep his ability to ejaculate. So a lot of men that are bothered by sexual side effects, sitting at home, taking medication, although it helps them urinate, and they deal with the sexual side effects. Well, you don't have to deal with those sexual side effects. There's an alternative. And an alternative is that you could have a minimally invasive approach that allows you to ejaculate. And also it's outpatient surgery. UroLift is something that has been introduced to this community. I'm very proud to have introduced it to this community. And my partners and I have been accruing a lot of patients to help them. And this is good because patients no longer have to travel to Houston or Dallas and Austin. We're a growing community. Our patients are very well educated and they do their research. And we want to offer them state-of-the-art new technology that is going to benefit their life. And we feel that we're just as competitive and up to state-of-the-art and new technology as well as other big cities.